If you have ever felt tired for no reason, noticed your ankles looking a little puffy at the end of the day, or seen something strange when you flushed the toilet and quickly told yourself it was nothing, then this video might be the most important 7 minutes you spend this week. Because your kidneys, those two small fist-sized organs sitting quietly under your ribs, are working around the clock to clean your blood, balance your fluids, and keep poisons out of your system. And here is the part that worries doctors the most. Kidney damage is often silent in its early stages. By the time most people feel obviously sick, a significant amount of kidney function may already be gone. So today, I am going to walk you through 10 hidden signs that your kidneys might be sending out as quiet distress signals. And I promise you, by the time we get to number 7, you are going to want to check something on your own body right where you are sitting. Stick with me until the end, because the very last sign is one that almost nobody connects to kidney health, and it could be the one that matters most for you or someone you love. Hey everyone, welcome back to the channel. I am Dr. Bennett, and if you are new here, this is the place where we take confusing health topics and turn them into simple, practical knowledge you can actually use. If that sounds like your kind of channel, go ahead and tap that subscribe button right now, because I post new videos every week that could genuinely help you catch problems early before they become emergencies. All right, with that said, let us get into it. Your kidneys do not get nearly the attention your heart or your brain gets, and that is a shame, because almost everything else in your body depends on them working properly. Think of your kidneys as the filtration plant for your entire bloodstream. Every single day they filter a huge volume of blood, removing waste products, balancing the salts and minerals in your body, controlling your blood pressure, and even helping make the hormone that tells your bone marrow to produce red blood cells. When that filtration system starts to struggle, the rest of your body starts to feel it in ways that are easy to blame on something else. Stress, aging, a bad night of sleep. That is exactly why these signs get missed so often, and why I wanted to make this video. Let us start with sign number 1, and it is one almost everyone brushes off, which is constant, unexplained fatigue. Now, everybody gets tired sometimes. We are all busy. We are all sleep-deprived. We all have days where we just want to crawl back into bed. But there is a difference between being tired because you stayed up late watching one more episode and being tired in a deep, bone-level way that does not improve no matter how much you rest. When kidney function declines, waste products and toxins that should be filtered out start building up in your blood. This buildup, sometimes called uremia in more advanced stages, can make you feel sluggish, foggy, and drained in a way that feels different from ordinary tiredness. On top of that, healthy kidneys produce a hormone called erythropoietin, which tells your body to make red blood cells. When kidney function drops, erythropoietin production can drop too, leading to a form of anemia. Anemia means your blood is not carrying enough oxygen to your tissues, and that alone can leave you feeling weak, breathless after small efforts, and mentally slow. So, if you have been chalking up your exhaustion to just getting older or being busy, it might be worth asking your doctor for a simple blood test to check your kidney markers, just to rule this out. Sign number 2 is swelling, especially in your legs, ankles, feet, and sometimes around your hands. Doctors call this edema. Here is why it happens. One of the kidney's main jobs is to balance sodium and fluid levels in your body. When kidneys are not filtering properly, sodium can build up, and your body holds on to extra water to try to dilute it. That extra fluid has to go somewhere, and gravity usually pulls it down into your lower legs and feet. If you press a finger into your shin and it leaves a little dent that takes a few seconds to bounce back, that is a classic sign of fluid retention. A lot of people assume swollen ankles are just from standing too long, flying on a plane, or eating salty food the night before, and sometimes that is exactly what it is. But if the swelling is becoming a regular pattern, especially if it shows up on both sides and does not go away after a good night's rest, it is worth paying closer attention to. Sign number 3, and this one is a big one, is any noticeable change in your urination habits. I know this is not the most glamorous topic for a video, but trust me, your urine actually tells a story about what is happening inside your body. There are a few specific changes to watch for. The first is foamy or bubbly urine, which can be a sign that protein is leaking into your urine, something that should not normally happen in large amounts. The second is a significant change in color, particularly urine that looks dark, brownish, or tinged with blood, which doctors call hematuria. The third is a change in frequency, especially needing to get up multiple times at night to urinate, a pattern called nocturia, which can happen when kidneys lose their ability to concentrate urine properly. And the fourth is urinating noticeably less than usual, despite drinking normal amounts of fluid. None of these signs alone means you definitely have kidney disease. There are other explanations for each one, but together, or if they persist, they are worth bringing up with your doctor rather than just hoping they go away on their own. Sign number 4 is puffiness around your eyes, especially right when you wake up in the morning. This is closely related to the swelling we talked about earlier, but it deserves its own mention because people notice it on their face long before they notice it on their legs. When your kidneys are leaking protein into your urine instead of keeping it in your bloodstream where it belongs, your body loses some of its ability to keep fluid inside your blood vessels. That fluid can leak into surrounding tissue, and because the skin around your eyes is thin and delicate, it shows up there first, often as puffiness that is most noticeable first thing in the morning and tends to improve a little as the day goes on. If you have started noticing this in the mirror and it is becoming a regular thing rather than an occasional after a salty dinner kind of puffiness, that is worth mentioning to your doctor. Sign number 5 is dry, itchy skin. This one surprises a lot of people because it seems totally unrelated to kidney health, but there is a real connection here. Healthy kidneys help keep the right balance of minerals and nutrients in your blood, including calcium and phosphorus. When kidney function drops, phosphorus can build up in the blood, and this mineral imbalance is one of the contributing factors to dry, itchy, sometimes flaky skin that does not respond well to lotion or moisturizer. Of course, dry skin has plenty of other causes too, like cold weather, hot showers, aging skin, or certain skin conditions. But if you have tried all the usual fixes and your skin is still uncomfortably dry and itchy, especially combined with any of the other signs we are talking about today, it is one more piece of the puzzle worth considering. Now, sign number 6 is something that creeps up slowly and is easy to dismiss. And that is a loss of appetite or a strange, persistent metallic taste in your mouth. When toxins build up in the bloodstream due to reduced kidney filtration, it can actually change the way food tastes to you, often described as a metallic or ammonia-like taste. This can make food less appealing, lead to unintentional weight loss, and sometimes even cause mild nausea, especially after meals. People often attribute this to stress, a stomach bug, or just being off their game for a while. But if you have noticed that food just does not taste right anymore, or that you have lost interest in eating without trying to diet or change your habits, that is a signal your body might be sending that something deeper is going on. Sign number 7, and this is the one I mentioned earlier that I want you to really pay attention to, is trouble concentrating, also sometimes described as brain fog. This happens for a few overlapping reasons. First, the anemia we talked about earlier means less oxygen reaching your brain, which can cause sluggish thinking. Second, the buildup of waste products in the blood can directly affect brain function, leading to difficulty focusing, memory lapses, and a general feeling of mental cloudiness. Third, disrupted sleep from needing to urinate frequently at night, which we covered in sign number 3, compounds the problem by leaving you chronically sleep-deprived. A lot of people blame brain fog on stress, aging, or simply being overworked, and often that is exactly what it is. But if you have noticed a real shift in your ability to concentrate, especially alongside fatigue and changes in urination, it is worth connecting those dots rather than treating them as separate, unrelated issues. Sign number 8 is muscle cramps, particularly in your legs, and especially at night. Your kidneys play a critical role in regulating electrolytes like potassium, calcium, sodium, and phosphorus. These minerals are essential for normal muscle and nerve function. When kidney function declines, these electrolyte levels can become imbalanced, and one common result is muscle cramping, particularly in the calves, that can wake you up in the middle of the night. Now, muscle cramps are extremely common and have plenty of other causes, including dehydration, certain medications, intense exercise, and simply aging. But frequent, unexplained cramping, especially when it is a new pattern in your life and not something you have always dealt with, is worth mentioning to your doctor, particularly if it is showing up alongside any of the other signs on this list. Sign number 9 is high blood pressure, and this one works in both directions, which makes it especially important to understand. Your kidneys help regulate blood pressure by controlling fluid balance and producing hormones that affect blood vessel tone. When kidney function starts to decline, this regulation can become impaired, leading to higher blood pressure. At the same time, high blood pressure that goes uncontrolled for years can itself damage the small blood vessels inside your kidneys, creating a kind of feedback loop where each problem makes the other worse. This is part of why doctors pay such close attention to blood pressure numbers during routine checkups, even when you feel perfectly fine. If you have recently been told your blood pressure is creeping up, especially if it used to be normal, it is a good moment to ask your doctor whether your kidney function should be checked as well, since the two are so closely connected. And finally, sign number 10, the one I promised you at the start of this video, is persistent pain in your back or sides, specifically in the area just below your rib cage, known as the flank. Now, I want to be clear here. Most back pain has nothing to do with your kidneys. The vast majority of back pain comes from muscles, joints, or spinal issues. But kidney-related pain has a few distinguishing features worth knowing. It tends to be felt deep on one or both sides of your back, just under the ribs, rather than centered along your spine. It can sometimes be accompanied by fever, chills, or changes in urination, which would point toward an infection. And in the case of kidney stones, the pain often comes in intense waves that can radiate toward the lower abdomen or groin. If you are experiencing back pain combined with fever, blood in your urine, or pain that comes in severe waves, that combination is worth getting checked promptly rather than waiting it out. So those are the 10 signs: unexplained fatigue, swelling in your legs and feet, changes in your urination patterns, puffiness around your eyes, dry, itchy skin, loss of appetite or a metallic taste, trouble concentrating, muscle cramps, rising blood pressure, and persistent flank pain, especially when paired with fever or urinary changes. I want to be honest with you about something important. Having one of these signs occasionally does not mean you have kidney disease. Your body is complicated, and almost every symptom on this list can be caused by dozens of other, far more common and far less serious conditions. The real value in knowing these 10 signs is pattern recognition. It is about noticing when several of them show up together, or when one of them sticks around longer than it should, and treating that as your cue to get a simple blood and urine test, rather than waiting for things to get worse. Here is something that I think gets lost in a lot of health content out there. Kidney disease in its early stages is one of the most manageable conditions in modern medicine, if it is caught in time. A simple blood test that checks your creatinine and estimated glomerular filtration rate, combined with a urine test looking for protein, can give your doctor a remarkably clear picture of how well your kidneys are functioning. These tests are inexpensive, widely available, and often already included in a routine annual physical. The problem is not a lack of available testing. It is that most people never think to ask for it because they assume their kidneys are fine until proven otherwise, instead of being proactive about checking. If you are over 40, if you have diabetes or high blood pressure, if kidney disease runs in your family, or if you have simply noticed 2 or more of the signs we talked about today, it costs you almost nothing to ask your doctor for these tests at your next visit. I also want to take a moment to talk about prevention, because protecting your kidneys is not complicated, even though it sometimes gets buried under confusing advice online. Staying well hydrated throughout the day helps your kidneys flush out waste efficiently. Managing your blood pressure and blood sugar, if you have diabetes, protects the delicate blood vessels inside your kidneys from damage over time. Being thoughtful about your use of over-the-counter pain relievers, particularly non-steroidal anti-inflammatory drugs taken regularly over long periods, matters because these medications, while generally safe for occasional use, can put extra strain on your kidneys when used frequently over months or years. Eating a balanced diet that is not excessively high in sodium and processed foods supports healthy blood pressure and reduces the workload on your kidneys. And simply getting regular checkups, even when you feel completely healthy, is one of the most powerful tools you have, because it lets you catch subtle shifts in your kidney function long before symptoms appear. I know health videos like this one can sometimes feel a little unsettling because nobody wants to sit there mentally checking off symptoms and wondering if something is wrong with them. But I would rather you walk away from this video feeling informed and a little more in tune with your own body than walk away feeling scared. Knowledge like this is not meant to cause anxiety. It is meant to give you a kind of internal radar, so that if your body ever does start sending out these signals, you recognize them quickly and take action early, when treatment options are at their best and most effective. That is really the whole purpose behind this channel. I am not here to alarm you. I am here to help you understand your own body well enough that you can be your own first line of defense. Before we wrap up, I want to ask you for something small but genuinely meaningful to me. If this video helped you understand your body a little better today, do me a favor and drop a comment down below. Tell me which of these 10 signs surprised you the most, or if you have noticed one of these in yourself or someone in your family. I read through comments regularly, and honestly, some of the best topics for future videos come directly from things you all share down there, so do not hesitate to ask questions too. And if you know someone, a parent, a sibling, a friend, who might benefit from hearing this, please take a moment to share this video with them. You genuinely never know whose health you might be quietly protecting just by hitting that share button and sending this their way. It costs you nothing, and it could mean everything to them down the road. And if you have not already, go ahead and subscribe to the channel, because every single week I am breaking down topics just like this one, taking the kind of information that usually gets buried in confusing medical jargon and turning it into something simple, clear, and genuinely useful for your everyday life. Hit that bell icon too if you want to make sure you do not miss the next video, because trust me, there are some upcoming topics that I think are going to surprise you just as much as some of these kidney signs did today. Taking care of your kidneys really comes down to paying attention, staying a little curious about what your body is telling you, and not being afraid to ask your doctor a simple question or request a basic test, even when nothing feels dramatically wrong. Most of the time, these signs will turn out to be something minor and easily explained. But every once in a while, catching one of these patterns early makes all the difference in the world. And that is exactly why I wanted to make sure you walked away from this video knowing what to look for. Thank you so much for watching all the way to the end. I genuinely appreciate you spending this time with me today. Take care of yourselves, take care of those 2 quiet, hard-working organs sitting under your ribs, and I will see you in the next video. This has been Dr. Bennett, and until next time, stay curious, stay informed, and stay well.